Hey everybody, today we're going to talk about cervical pain or neck pain as it relates to posture. So one of the things I see most common in the clinic is folks who come in who have neck pain after a prolonged time either at work or sitting in the car or basically a prolonged time in any one postural position. Now, oftentimes this is the byproduct of spending too much time in what I call a passive posture. So we have two different types of posture. We have a passive posture and an active posture. A passive posture is when we're hanging out kind of on the connective tissue and some of those non-contractile properties, or those non-contractile tissues. An active posture is when we're using our muscles as kind of our support system to maintain the posture. So what a passive posture looks like is the shoulders kind of rounded forward, the head pushed forward. We're not really kind of controlling this with any one muscle group. An active posture is kind of that textbook perfect posture where we've got the shoulders pulled back, the head in kind of good alignment, and we're really using our muscles to kind of stay upright. Typically, if we find somebody who has pain from spending too much time in that passive posture, what we tend to do is approach this in a fourfold manner. The pectoral muscles, or those kind of muscles on the front of the chest, we work to kind of loosen those up, kind of add some extensibility through those tissues. The deep cervical neck flexors, or some of those guy wires on the front of the cervical spine, we want to strengthen those. We have two different areas in the back that we address. So the suboccipital muscles, or the muscles right underneath the base of the skull, we're going to work to try to loosen those up the same way that we're working to add some extensibility through those pectoral muscles. And then finally, the muscles kind of between the shoulder blades, so that kind of stereotypical good posture, we're pulling those shoulder blades back. We're really going to be working on strengthening those parascapular or around the shoulder blade muscles. Now, every inch that your head gets pushed forward into that passive posture, so if I'm hanging out in that passive posture, for every 1 inch that my head is pushed forward, that's going to add 10 pounds of force down on my cervical spine. You can see that over the course of like a 6 to 8 to 10 hour workday, that's really going to add up. So the goal here is let's get you stronger in that active posture position, and then eventually let's take that one step further. Let's be able to kind of recognize, when does my body need a rest from that active posture? Because if we squeeze our muscles all day, our muscles are going to be totally worn out. So let's take it one step further and see if we can kind of get you in and out of different postures. All in all, the best posture is the next posture, or the best posture is a changing posture. We want to be able to control active postures and recognize when our body needs a rest from those passive postures, and let's get into a different kind of position. This first exercise is the scapular retraction. The goal here is to improve our movement strategies and find that active posture. So all you're going to do is you're going to squeeze your shoulder blades in the back as if I'm trying to pinch something right between my shoulder blades. I'm going to open up in this position. I'm activating those postural muscles. I'm stretching out the pecs. I'm going to hold for 2 or 3 seconds, and I'm going to relax. So you can kind of see my shoulder blades are pulling down and back. I'm making sure to not come up into my ears here. So I'm keeping my shoulders out of my ears, but I'm pulling them down and back as if I'm trying to squeeze something right between them. Holding for a couple seconds and relax. My favorite thing about this exercise is you can do it anywhere. You can do it standing in line at the grocery store. If your back is getting a little stiff, you can do it sitting in your office chair if you find that the neck is getting a little stiff there. You can even probably do this one while you're driving. So I'm squeezing the shoulder blades back, holding for 2 or 3 seconds, and relax. Squeeze back, hold 2 or 3 seconds, and relax. There's no kind of set or perfect dosage with this one. It's kind of on an as-needed basis. You can do a lot of these, and you're not going to get overly fatigued. If you're looking for a good starting spot, I would suggest maybe at least trying to hit about 8 to 10 of them in a row, holding for that 2 or 3 second count, and then taking a rest, trying to fit in at least 2 or 3 sets throughout your workday, or whatever kind of event triggers your symptoms, whether it's childcare, workday, whatever it may be. Trying to hit at least 2 or 3 sets during that event. The next exercise is the chin tuck. So the chin tuck is a great exercise to, again, learn that active posture position. We're going to get some activation through those deep cervical neck flexors and maybe get a little bit of a stretch through those suboccipital muscles in the back. So what you're going to do is we're going to try to get out of that forward head posture. So if you find yourself kind of typing at the desk and you notice that, my head has been forward for a long time, I'm starting to get a lot of pressure kind of behind my skull, what you're going to do is you're going to take your chin straight back towards your windpipe, as if you're trying to make almost that double chin type move. So taking the chin from here, straight back towards your windpipe. A couple kind of small notes here. I'm not extending my neck as I come back, and I'm also not flexing my neck a lot as I come back. I'm keeping my gaze right forward, my head's in a neutral position, and I'm just trying to retract my chin. This is usually done best if we give it a little bit of a shoulder blade squeeze too. So kind of comboing this exercise with the first one that you learned. So a little bit of a shoulder blade squeeze and then pulling the neck back. If you're new to this, it's not going to feel like you're moving very far, and that's okay. Whatever your comfortable range of motion is perfect. It's a great one to kind of start learning that active posture position. A good dosage for this is going to be pull the neck back into that tuck, my gaze is straight forward. We're going to hold for about a 5 count, and then we're going to relax. Pull back, hold for a 5 count, and then relax. Again, I'm pulling that chin back, hold for a 5 count, and relax. I typically tell my patients, let's start with about 6 to 8 of these, holding for that full 5-second count for each repetition. Again, this is another one where we're not really overly fatiguing any one muscle group, so we can do a lot of these throughout our workday without getting overly fatigued. A great starting point though is about 2 to 3 sets, 6 to 8 repetitions, holding for a 5-second count. The next exercise is a pectoral stretch. So the pectoral muscles are the muscles on the front side of our chest. If we're spending a long time driving throughout the day, or if we're spending a lot of time typing, our pec muscles can get super tight. It's a really nice idea to kind of stretch these muscles out before, during, and after your workday. There's a lot of different options here to get some mobility through the pectoral region. One of my favorite is starting by grabbing a wall, kind of putting your palm on the wall, and then just turning your body away. You should feel a nice stretch all along the front of your chest here. Another nice option is if you have a doorway, you can kind of put your palm right on the doorway. So imagine there's like a doorway right here, and you can kind of open up, adding some extensibility to the front of the chest. If you just got home from your workday and you're looking for some different options, another great option is dropping down onto the floor and then just kind of putting your arms in this 90-90 position out to the side. So elbows are going to be kind of at a right angle and shoulders are at a right angle, and we're just kind of letting our elbows melt into the ground. A good dosage for any one of those 3 options. So I'll go through them again. So the first one here, I'm already on the floor, is that kind of floor pec stretch where our elbows are at 90 degrees, our shoulders are at 90 degrees, and we're just kind of letting our arms melt into the ground. You can kind of play with the angle a little bit to see what's most appropriate for you, what feels the best for you. And you're going to hold it for about 30 seconds, 2 to 3 rounds. The next kind of position is grabbing that wall space, holding your palm on the wall, turning away, kind of open up the front of that chest. And then finally, if you have a doorway, you can also do it that way. Any of those 3 positions are perfect to start stretching out the chest or the pectoral region, and it should feel really good to do so. This next exercise is called Thoracic Extension. So as well as the muscles, the joints can also get a little stiff if we spend too much time in a prolonged posture. So if we've been kind of typing away all day, sometimes our upper back or our thoracic spine can really tighten down, and that puts a lot of stress on our cervical spine or our neck. So I'm going to show you 2 different options to do this, one of which you can do during the workday, one of which you can do while you're at home kind of resting. We're going to grab a foam roller. If you have one, great. If you don't have one, it's a really good investment for postural related conditions. However, you can also probably use a bolster for this one or wrap up a couple bath towels. You're going to put your foam roller on the ground, and then you're going to set up in a hook lying position or laying on the ground with your knees bent, and you're going to put that foam roller right underneath your shoulder blades. So right kind of on top of those shoulder blades, and then you're just going to bring your hands right behind your head. What you're going to do is you're going to extend your back towards the ground, just kind of slowly dropping down, exhale, and come back up. So I'm letting my head drop towards the ground here, just until I feel a pretty good stretch. I'm going to find that end range, and then back up. Okay? I typically am going to go for about 10 to 12 here. My butt stays on the ground as I go, so that I'm not overextending my back, but I'm just staying within my comfort zone. And I'm making sure I'm not flying too far open at the elbows, but I'm keeping those elbows kind of tucked. And then back up. You can kind of play with the angle a little bit here if there's one spot that feels a little stiffer than the rest. So generally you want to be kind of right on those shoulder blades, but you can kind of move up or down a segment or two depending on what you feel like your body needs. Typically I'll tell my patients go for about 10 to 12 here, then take a rest. If you feel like you still have some mobility to go, you can do 2 or 3 sets of these, about 10 to 12 sets, or 10 to 12 repetitions through. All right, so additionally, we can also do this one during the workday. So we're gonna grab a chair, and if you're at work with kind of a hard back chair, if you're at home with a hard back chair, you're gonna sit so that your back is against the very edge of it. Okay, so this is kind of cutting me right around mid-shoulder blade height. You can do one of 2 things. We can either cross the arms across the chest here, or again, you can go right hands right behind the head, and then you can lean back and kind of use that chair as a fulcrum to open up. Same dosage here, about 10 to 12 repetitions, and you can kind of slide forward in the chair to change your angle a bit, or sit a little bit higher if you need to be higher up, or throw a pillow underneath your seat to find the right angle for you. With a thoracic extension, we want to be going for at least 10 to 12 repetitions, 2 to 3 sets through during our day. This is the last exercise of phase 1, and it's called an open book. So this is a great exercise to get some mobility through the pectoral region and get some mobility through that thoracic spine. We're also going to get some rotation through the cervical spine, which could feel nice. You're going to set up in a side lying position. So we're going to do it on both sides, a side lying position with your knees bent kind of at a 90-degree angle at the hip as well. Your bottom hand is going to lay right on top of the knees just to keep your hips from rotating. Your top hand is going to reach forward as if I'm kind of reaching towards the camera here. And then you're going to open up. I'm kind of twisting my upper torso and I'm rotating open. My eyes are going to stay on my hand as I rotate to get some rotation through my neck. And then you're going to reach back. You're going to rotate open, pause for a breath or 2, and then reach back. And I'm making sure I'm not leaving this short here, but I'm really trying to reach and roll through, and then opening back up. If your shoulders are uncomfortable with that, so some folks with some rotator cuff pathologies, shoulders can be a little uncomfortable, just place your shoulder or your hand on your opposite shoulder, and you can still do the same movement and get a lot of the benefit, but take some of the pressure off the shoulder. If your shoulder feels okay with it, you might as well kind of add that hand. It's going to give you a little bit of a longer lever arm. So from the other side, I'll kind of show you what this is going to look like from the back side. So you're still on your side, bottom hand's on top of those knees, and then you're rolling open. My eyes should stay on that moving hand, and then I'm reaching back. We're going to hold again for just 1 or 2 breaths here, feeling that stretch of the pectoral muscles, and then reach back. Eyes stay on that hand as I open up. I'm feeling that stretch all along those pectoral muscles, a little bit in the back side, and then back. A good set and rep scheme for that one would be about 10 repetitions, 2 or 3 sets through. Should feel really good.